Last October 14, 2022, the University of Douala Medical and Pharmacy Student Association launched a health campaign in Dschang to help the IDPs from LECDA, a project that was co-sponsored by the LECDA USA with a sum of $1,200. Gasamija reached out to the CEO of LECDA USA, Professor Ndemanu, to find out how successful the campaign was.
Those activities. Can you just briefly maybe throw more light how successful was that event?
Yes, those students reached out to us to support the initiative, and that's part of what we do. That is, we outsource some of our projects. We identify competent organizations on the ground to carry out activities on our behalf. And UDEMSA was just one of those organizations that reached out to us, and we disbursed some money for them to go to Dschang and help our vulnerable population that is internally displaced. And the report that was shared with us showed massive participation of the BLM people. They were able to reach hundreds of people who have been sick and who have not had money to go to hospital. And we are working with LECUDO USA to also carry out a similar health campaign, and I think that's coming up in March or so, and people should stay tuned on that.
From the overall information given by Professor Ndemanu, Gasamija contacts leadership of LECUDO USA to know more about this year's health campaign, and he tells us it will be taking place as from the 15th to the 17th of March in Fontem and from the 20th to the 22nd of March in Dschang. Listen to what he has to say.
This year's medical campaign is going to go all the way to Mental Health of Africa Hospital. So we will endeavor, to be able to meet those people that cannot come to Dschang in the village. And by this, we are appealing that people should they should be able to send out messages, tell your neighbor that this medical mission is coming up in March. And I think Terry is going to be able to talk on the exact date so that people know when to come out.
Right, so I think you raised a point. Now, the medical mission last year was just in Dschang. But this year, we decided, especially with instructions from also, recommendations from the General Assembly, that we're going to hold the first phase in the village in Maryhill. And this is going to be from March the 15th, which is a Monday, through March the 17th, which is a Wednesday. And then people are going to, anybody who needs specialty care, because of the limitations of Maryhill, will then have a few days to be able to come to Dschang. And we're going to have the program in Dschang from March the 20th to the 22nd. So Maryhill is going to be 3 days. That's Maryhill in Fontem. It's going to be 3 days. And Dschang is going to be 3 days. So Maryhill is from March the 15th to March the 17th. And the program in Finger Clinic is going to be from March the 20th to March the 22nd. And it is important that we emphasize, if people see March the 19th for the Dschang program, March the 19th, Sunday, which is a Sunday, that's actually the date that the volunteers have to get to Dschang. It's not the date that they are receiving any patient. So they're getting to Dschang on Sunday, which is March 19th, but the effective program for any patient is going to be from Monday, which is March the 20th. So we need to emphasize it. And we have doctors coming from Canada, the United States, and then of course a lot of doctors from Cameroon.